Namaskar and welcome to yet another exciting episode of Age with Grace. Age with Grace is a health awareness program for the social media sites. My name is Krishna Verma and I'm going to be the anchor for this episode. In Age with Grace, we discuss and talk to renowned urologists across the country about the urological disorders, their prevention and care. And today we have a very renowned urologist of the country, ladies and gentlemen. We welcome Dr. Shafiq Ahmed. He is the Director, Urology, Andrology and Renal Transplant at BLK Max Super Specialty Hospital, New Delhi. We welcome you, sir.
Thank you very much.
Now, a very important topic that we're going to be discussing with sir is about the prostate cancer, which is actually growing nowadays. We can actually hear about prostate cancer with many patients. So, what is prostate cancer?
Yeah, so as per the US Registry of Prostate Cancer data, there is around 8% chances of a male having a prostate cancer in their lifetime. And as in one study, it was found that around 30% of the patients who died after the age of 80, and their autopsy showed that around 30% of the patients had a prostate cancer in their prostate, whether it was symptomatic or not, that was not found. So the prostate cancer is one cancer which is the second largest number of cases by which the men suffer after the lung cancer. So the prostate gland, as we know, that it's a accessory sexual organ in our body, and after the age of 50 it starts proliferating. The most common disorder in the prostate is always a BPH. However, the prostate cancer cannot be ruled out unless until it is really diagnosed in any individual. We know that the prostate cancer does not have any specific symptom when it comes to the clinical presentation, unless until it is very, very late, when you have a disease spread throughout the body, you have bone pain, or you have any other systemic disease by which the patient can present. Otherwise, the majority of the patients with the prostate cancer, they present with the lower urinary tract symptoms, by which we always take these patients as an individually, as an initial stage, as a BPH. And once we evaluate them, then probably only we come to know whether the patient is having prostate cancer or not prostate cancer.
And what are the diagnoses for prostate cancer?
Yeah, as I mentioned, there is no specific clinical signs and symptoms for the prostate cancer. We can say that it's a very silent disease. That's why we must do a PSA test every year after the age of 50 to diagnose those indolent or those hidden cases in the society. This is the only one cancer in the male body which can be screened. Like the breast cancer in the females, we can screen. The cervical cancer in the females, we can screen. So in males, the prostate cancer can be screened, and we can pick up those cases which are not really clinically apparent. So that's why the PSA test is a must to diagnose the prostate cancer. Now, when the PSA is actually high, above the normal range, then the second test which we do is a MRI of the prostate. Once the MRI proves that there is some structural abnormality or there is any nodule in the prostate which is suspicious of cancer, we go for the biopsy. So the biopsy is the ultimate diagnostic test for any patient to be diagnosed with the prostate cancer.
And what are the treatments for the same, sir?
Yeah, so for any cancer, whenever it is diagnosed, the first thing for a clinician is to stage the disease. Whenever there is a cancer, every stage has its own presentation and the treatment protocol written. So same is applicable with the prostate cancer also. The treatment of choice for the prostate cancer in stage 1, stage 2 and even stage 3, which we call nowadays as a locally advanced or disease well within the pelvis, is only and only robotic prostatectomy, because that's the only treatment which gives a hope for the complete cure to these patients. And then comes stage 4 disease, in which the surgery does not have a role, or even for that matter the radiation does not have a role. We go for the radiation, androgen ablation or the chemotherapy. Those are the very advanced stage. That's why in every academic forum, in every informative discussion, we always request the public to do one PSA test, which will diagnose this disease at a very early stage, and you can be 100% cured. But unfortunately, if this disease goes beyond the stage 3, if it goes in stage 4, then it is really a dreaded and very bad disease, which can kill the patients in a matter of months only.
And what all changes that you would like to tell our listeners and viewers that they can get their lifestyle changes basically to avoid such urological diseases?
You see, when we talk about prostate health, whether it is a BPH, or whether it is a prostate cancer, whether it is urinary tract infection, or whether any other complication arising due to the enlargement of the prostate, we have certain advice for our patients to change their lifestyle, how they drink, what they drink, how much they should drink, and as I said always, that they must avoid the carbonated drinks, the caffeinated drinks, which stimulates the bladder and exaggerate the symptoms of BPH or any other prostate disease. For the prostate cancer detection, I have always maintained, and I always mention in every forum, in every talk of mine, that we must take PSA after the age of 50 every year in our health checkup. That will pick up many cases which are silent in the society, and we can save many lives.
Thank you so much, sir. It was a fantastic discussion, and I'm sure our viewers would have taken much more about the prostate cancer, and we are very, very glad to have you at Age With.
Thank you very much. Thanks a lot.